Today we're going to start off by asking the Minister for Health some questions in relation to the report that was released yesterday. Obviously this is something that's fairly sort of just come into the public domain, so therefore we thought it was appropriate to actually ask a number of questions, and I will be asking Deputy Kevin Campion to start with those questions.
Thank you, Chair. So, last night this report was released. I stayed up last night to read it and have gone through it, and very curious to hear the Minister's response. I know this morning to certain parts of the media you declined to go into further detail, but we just felt, given today's public hearing, giving you the opportunity as Minister for Health, and because of the public interest, to start by asking you for your view and your comments, especially because you seem to you seem to reject the majority of this report's findings. So, just like to start to ask you why you came to that conclusion.
Well, Deputy, I thank you for your question. But, you see, this has been a group that was set up to advise the Council of Ministers. It has given its report to the Council of Ministers, but the Council of Ministers has not yet discussed the contents of the report. And I believe that those discussions should proceed, obviously didn't proceed yesterday, before we have any further discussion in a public arena. So I don't wish to disclose now, because I don't think that's good government. It's not good procedurally. This is a government project and policy which, if there are doubts about it, they first need to be discussed and thrashed out at government level. And then the Chief Minister said he will submit the further decision for the states. But I don't think it is at all helpful for me now, perhaps adding fuel to the fire, when the Council of Ministers has not yet had an opportunity to discuss this.
I appreciate that. I feel though, because you were part of the panel, you could provide our panel some insight to that, because you are the Health Minister. And it's interesting in the report because it refers to the Comptroller General's findings of both our reports into the governance of healthcare, which we've discussed in the States Assembly, that one of her major issues she had, you could call it that, was that the clinical lead was the driving force of this big project, which was one of the big political decision failings of the previous decision. You are therefore now, of course, the Health Minister, and therefore the responsibility of the clinical lead of the delivery of the hospital. And you've been on this panel for the last 4 months. So I feel, while I agree, I think we all agree that you're quite right, there's a process with the Council of Ministers, but given your position in the panel, and reading some of the minutes, you did have a position that's in public record. So just want to ask more